Everybody's awake. That's impressive. So I'm the last one, and I will try to shorten up as much as I can. But when Karen and Nikki invited me to talk, I think that one of the reasons they wanted to invite me was because I am a survivor myself. So we work on prevention primarily, but we started out with survivor support, and that's because I needed that myself. And I want to tell you just a tiny bit about my background because it gives some relevance to what I'm going to talk about. I'm a survivor of incest, and my father raped me between 10 and 14. But of course, the grooming started earlier than that. I never told anyone until I was in my mid-40s. And that's really common. Rain Lily's research will say, I think from reported cases we have here, there's usually about a 13-year delay. And super common. My father's method was, he told me that's what love is. I don't think I ever had any kind of genital damage. I don't think if anybody had asked me directly, I would have said I wasn't consenting. But no child can consent, period. And like everything else in Hong Kong, there's lots of different rules. We actually don't have a rule for a child. So when I say child here, I'm using the WHO definition of under 18. So we work on prevention primarily by doing research and turning that research into programs. So I want to talk a little bit about what we do. You'll see there first, I'm using the darkness to light training for adults. We really focus on training adults to know how to prevent abuse and to reduce the opportunity for abuse to happen. Secondly, we have done some groundbreaking research on what is the situation in Hong Kong in terms of what does the official data tell us and what is more likely the real prevalence, which is quite different. And we also still do support groups for survivors, both male and female. And so over the years, I've had hundreds of women and now a few men. We just started the men's group this year. So I'm going to talk a little bit anecdotally about my experience. And first, I'm going to skip this. This was a little event, but for time, I'm going to skip that. First, we're going to look at some data because we've talked a lot here about how to treat, that it's a bad thing, but we haven't talked about the numbers, and that's really critical. So what you need to know to make good decisions are really basic things at the very least. You know, who is it happening to and who's doing it? And then you can make specific plans to prevent it. But in Hong Kong, we just don't track that data through the government departments. They track different data between them, and there are a lot of things that just aren't tracked yet. So we know, the age, we know some really basic data about perpetrators, but we should know some good basic things. And we won't go over that all now. Please have a look at our website and look at the data in detail. But when we did our research, 12% of kids in Hong Kong suffer some kind of abuse. In time, I hope we can get more accurate with that with a large-scale survey. But you'll see in any country, Australia, UK, and the WHO would even say 20%, but this is a really common number, 12% of kids. It's not terrible and rare. It's terrible and very, 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 very common. And unfortunately, it is a gendered crime. I haven't put it here, but in Hong Kong, we actually have a little bit higher male victimization than in some other countries. It's about 9% of boys and 15% of girls. So that means it's 96% unreported. And most of the women who turn up at my support group, and men too, I have to remember to include them since they're new, most of them have never reported. Maybe they've told a family member, but they have not reported to an authority. So keep that in mind when you're thinking about suspicious cases. And I guess there's the difference between what I emotionally know from lots of experience and legally what you need to look for, but know that there's usually not any physical evidence. Know that they usually won't tell you. In the reported cases, 72% knew their abuser. I would say if we had better reporting, that number would be much, much higher, because almost all of the people that turn up at our support groups are incest survivors. And last year, the police, I think, recorded 0 cases of incest, and the year before, 1. I think we can all understand that there's something very wrong with that. And to me, what it means, what it indicates, is that incest survivors are reporting less or delaying reporting much, much more. So when someone here discussed having the child lie in the lap of the mother, a chill went through my spine, because that mother may not be the safest person in that kid's life. 85% of known victims were girls. Again, this is about the reported numbers we can see through social welfare police. And 93% of known perpetrators were boys and men. And yes, a lot of boys, someone else mentioned, it's not only adult males who are perpetrating, it's increasingly boys. All right, what does all that mean? Yes, it's bad. We feel bad when it happens to us, but there's some real impacts on society and on that person. And I loved what Dorothy said about, you're going to save this generation and the generations that follow, because it's very often a generational trauma. But if you just look at that individual, hospital authority data itself shows that, by the way, this data is about 10 years old. We're hoping to update it if I can get a hold of that data. 242 times more likely to attempt suicide, 18 times more likely to have an injury, some other kind of physical injury in their lives, 12% more likely to have mental health problems. And I don't have the actual number on it, but obviously they're going to have shortened lifespan, autoimmune issues, and substance addiction issues. And another piece of research I'm hoping to do here in Hong Kong, but this is a great look at just sexual assault for adults in the EU, the cost that it has on a society. It's more than cancer. And I'm sure we'll find a similar number when it comes to child sexual abuse. It's massive. And anything we can do to reduce not just harm to individuals and their emotions, but what we as taxpayers pay into the system because of something that's so preventable. So when Nikki and Karen asked me to do this talk, they also wondered, well, we talked about it together, about if I could ask people in the support groups if they could imagine what they would want from doctors when they were kids. So in our next meeting, I did ask them, and it's a small group, but it was an interesting conversation. Most of them never went to the hospital for the abuse they suffered, and most of them were penetratively abused by fathers, brothers, uncles. But the number one thing they said was just kindness, because for a lot of them, they're in a multi-abuse situation. It might be one of the only times in their life that someone is gentle and kind to them, and that is super powerful just in itself. The other thing is that I know it's really hard for doctors. You're in a rush, you have limited time to get a million things done, but understand how impossibly hard it is for survivors from 5-year-old, which is a really common age for abuse to start, actually, to 50-year-old. It's really hard to tell. It feels like the end of the world, the first couple of times that you do it. And understand how hard it is to be touched by someone when your whole sense of safety has been betrayed. So give yourself that extra couple of minutes to, like Florence said, develop some kind of rapport with them. And figure out before you ask them to whether that mother is the right person to ask them to put their head in the lap. Choice. And I know this is a rough one because you're in a hurry, but try really hard to use language that gives people choice. One of the survivors who did go to the hospital when she was a young teen who was abused in the family setting and was kept in the hospital because the doctors did recognize we need to keep her here as long as we can to keep her safe. Wow, but in a general ward, the curtain was closed and the nurse really awkwardly asked her, I think I need to look in there, but didn't really know what they were doing. It was in the public ward. It was not an awesome experience. So again, it's about giving that little bit of extra time and at least the feeling that they're making the choice, not being forced to get on the bed. So I want to talk a little bit about prevention too. This is the prevention training program. It's an American program, and it's just the only one I could find to get certified in, to be frank. And this is really for any adult. Could be for parents, teachers, neighbors, medical professionals, but it's about how to understand how abuse happens, because it's usually not by strangers. It's not once. It's usually by someone you know over many, many years, even someone who's built trust with the family. So learning how to understand that process and how you can, receive a disclosure from a child, what to do. In Hong Kong, as we know, there are lots of different departments, none of them experts, but who to report to if reporting is the right thing to do. So that's a 2.5-hour class. I'd be happy to see any of you there, but please let people know that exists, because I think it's important that adults are responsible for preventing abuse. A lot of times when I talk about this, people say, oh, well, shouldn't you be in schools telling kids? Come on, what other kinds of abuse do we tell kids they're responsible to stop? And the more research that comes out, we're seeing that it also just does not work. Anyway, this is a bit about us and just our background. I'll skip over that for now, but we've grown a lot in the last couple of years, and we'd love to have anyone's participation who's interested. But I want to send you home with some homework, even though you are professionals that probably know a little bit more than your average bear about this stuff. There's still a lot you can do in your personal life that will help kids and save, like Dorothy said, that next generation. Ask any organization that has anything to do with your child, what's your safety plan? What are you doing for safeguarding? And here we're talking about, this seems funny, but I usually say to a general audience, dentists, doctors, tutors, because private tutors have no oversight at all. They cannot be records checked. They are not being trained to do mandatory reporting or anything. Read the report that I showed you some data from earlier. It really gives some good insight on what we do know and critically what we don't know in Hong Kong, but that we can improve and get better on planning prevention. Get trained. That's the stewards of children training that I showed you earlier, or any great training you can find. And if you do find another great one, let me know. I would love to see it. And in your personal life, no forced affection. Kids do not owe you a hug. That's a choice they should be making. I have a lot of wonderful European friends, and they're always saying, oh, kiss Auntie Taura to say hello because I think it's polite. And I always say, no, we'll wave and maybe later. And tell people what we talked about today. I think that's something that we all hesitate to do because it's an uncomfortable topic. It's a painful topic. Silence is really harming all of us. So please tell 5 people. And I think that's it. That's it. There are contact details, and I'd love to hear more from you.